right, good morning everyone. This is Beth Horner and I am the Customer Experience Manager for the North Carolina State Health Plan. I want to thank everyone for joining us this morning for our webinar. It is approximately going to take about 45 minutes to go through everything. We are going to be able to answer some of your questions at the end. We are going to spend time this morning going over some eligibility reminders, some administration reminders about the high-deductible health plan, give you a little bit of information about the benefit overview, the rates, and then of course do a demonstration of the billing functionality of the enrollment and billing portal. We did do a webinar in September that did kind of go into a little bit more detail about eligibility and the plan administration in terms of the plan itself and the particular carriers that were involved in administering this plan. So we're not going to spend a whole lot of time on that today because that webinar is available on the State Health Plan website for you to listen or to view the slides. Today's information is also going to be placed on our website probably around this afternoon or tomorrow morning. We'll have this presentation available for you to look at on our website on the HPR tab. I am going to be showing you a little bit of our website just to make sure everyone's aware of where this information is located in the event you need to use it for reference. So as you all know, the legislation was passed for a newly eligible benefit to have a minimal value plan to all full-time employees. Employees are considered full-time and must be required to be offered this employer-sponsored health care if they are reasonably expected to work 30 hours per week. So this extends the eligibility to non-permanent full-time employees who have traditionally not been eligible for coverage under the state health plan. Employing units are, of course, responsible for determining whether or not an employee is full-time. You do have a flexibility in determining that status through the safe harbor, your measurement period, or what some people call the stability or look-back period for determining that eligibility. If that method is not used, then you are able to determine eligibility every month. So one of the things that we have been getting a lot of questions here at the plan about is regarding eligibility. I am today going to touch a little bit about rehired retirees, but for the most part, in terms of eligibility and seeking information about your measurement period, the plan itself cannot provide any kind of legal advice to employing units in terms of adopting a uniform measurement for determining eligibility or really specific eligibility questions regarding your employees. So the legislation that you see here on your screen did establish a new benefit category for full-time employees, typically not covered by the plan, and it required the Treasurer and the Board of Trustees for the State Health Plan to offer coverage for these newly eligible employees that met the essential level, bronze level, for the Affordable Care Act. So this plan is called the High-Deductible Health Plan. A lot of people have gotten confused with some of the terminology that people have been using, such as the bronze level, newly eligible. So I just want to make sure that everyone's clear that it's called the High-Deductible Health Plan because that is the name of the type of plan that we're offering that meets the bronze level requirement under the ACA. So that legislation enacted or enabled the Treasurer and the Board to establish this high-deductible health plan to meet the requirement, which is available to these eligible employees as of January the 1st. Here is a very brief summary of the benefit of the high-deductible health plan, or what we call the ADHP. The deductible is $5,000 for an individual, $10,000 for family. It does have an out-of-pocket maximum, and the coinsurance is 50%. A nice benefit is that it does have your ACA preventive medical and pharmacy benefits is covered at 100% in network. All non-network benefits will be paid at 40%. This particular plan is eligible for a health savings account. account, which will allow your employee to make a tax-exempt contribution up to a certain amount that can help them use it for eligible medical expenses to kind of help them meet the deductible. This is not something that the state health plan provides. Employees will be responsible for setting up their own health savings account at a financial institution, but it is compatible with this plan. In regards to retiree eligibility, so it does require employing units to cover rehired state retirees as active employees if they are determined to meet the definition of a full-time employee and meet the eligibility for this plan. It also outlines that during the time of their full-time employment, they're not eligible for their retiree health benefit coverage under the retirement system. So this is consistent with what is already in place, requiring units to cover rehired retirees in permanent positions on a reoccurring basis for working 30 more hours a week. So what's important to note that it is you all as the employing units determining the eligibility, and if a rehired state retiree meets that eligibility, then they are no longer eligible for the retiree coverage under the retirement system. So if they do meet the eligibility, they are and they must be offered this coverage. They're not required to enroll in the coverage into the plan, but they're no longer eligible for the retiree coverage as required as stated by the law. So therefore the plan has to terminate the retiree from their state health plan retiree group coverage. What's important to note is that once you load eligible members into the portal and one of them is a retiree, you then must notify the plan of this particular employee. We then have to terminate the employee, and then we will send them a letter to confirm their termination of coverage under the retirement system. This is outside the normal process, so it is very important that you notify the plan. We send out, we did notify some groups a couple of weeks ago that had uploaded some retirees and we hadn't been notified of them yet. So it is important because we actually here at the plan have to take action to terminate them. It just doesn't happen. So we have to terminate them, and then we send them a letter to explain what's going on and the fact that they're going to be terminated and when their new coverage starts. So it is important that you follow this particular process. I'm going to show you on our website where the termination of coverage form is located. It's very similar to the exceptions form that some of you are used to filling out, but it involves the retiree's information, and then you would send it to the HBR inquiries box just like you do an exception. If they are enrolled in the high-deductible health plan, if a retiree is enrolled, at which point they're no longer eligible and they're already enrolled, they will be extended a COBRA offer. However, because loss of eligibility is a qualifying life event, they will have 30 days to re-enroll in the state health plan coverage under the retirement system. But just make sure they understand that if they don't re-enroll within 30 days, they won't be able to come back on the plan until the next enrollment period. So if you've deemed them eligible, let's just say during February of any given year, and they quit 2 months later, they have 30 days from that date to call in or go in through Orbit to re-enroll in their state health plan coverage under the retirement system. And that's a qualifying life event because it's losing eligibility under the ADHP. So they are able to do that. They just need to make sure they do it within that 30 days or they have to wait until annual enrollment. Just a brief reminder that members in this plan do have access to the MedCost PPO provider network. This is not utilizing the Blue Cross and Blue Shield of North Carolina network. The pharmacy benefit is still being managed by Express Scripts, but it does use a different formulary. And instead of pension deduction and things or check, members are going to be sent a monthly bill for their premium, which will be sent by CobraGuard, the plan's direct billing administrator. As you are all aware, there is an enrollment and billing portal that is set up just for this plan, just for HBRs and for employees who are enrolling in this plan. So they do not use e-enroll. And you do have to load these members into the portal in order to allow them to enroll in it. Here is an overview of the rates. As a reminder, the employer share for an employee is $117.62, and you can see the employee rates listed here as well. And we do have a rate sheet available on our website for those who are interested in getting more information about the rates for this plan. A couple of months ago, HBRs were sent a PDF of the enrollment guide for eligible members. You are responsible for sending this to members. We are not printing these because we do not deem the eligibility for this plan, so we don't know who to send it to. So it is the responsibility of the employing unit to send this guide out. It doesn't have any enrollment dates, so you'll need to send it to an eligible employee with information on when their open enrollment for this plan will be. We got a question this morning about a sample template to send out to members who are eligible. We don't have a template of an email. What HBRs and what groups have been doing is drafting, crafting their own message and then attaching the enrollment guide and sending it directly to the member, to their particular employee who's eligible. We do have a page on our website that is dedicated just to this plan for people who are interested in learning more about it, who are thinking about enrolling. It does have a benefit booklet, a summary, a rate sheet, the ACA preventive medication list, as well as the formulary for prescription drugs. So prior to us going into the enrollment and billing portal demonstration, Cobra Guard is on the line, and Carrie Cavanaugh with Cobra Guard is going to be doing the portal demonstration for us. I wanted to show everyone our website just to make sure everyone was aware of where this information was located. So this is our home page of the State Health Plan's website. We have a link here for high-deductible health plan. We have a link here, and we also have this banner here. So this information is for folks who are eligible for this plan, who are interested in enrolling. It has the rate sheet, the enrollment guide, the benefit booklet, a link to get more information about the network. It also has some information in terms of if they're having trouble with the portal of enrolling, they can call this number. Questions about the formulary, they can call Express Scripts. And then, of course, the MedCost provider information is there as well. The shpadhp.com website that you see here, this is the employee site. So this is the site that they will go to actually enroll in this plan. If you go to the HBR tab of our website, the first bullet that you see here has all the information regarding this plan. We created a reference guide to provide additional assistance to employing units about the eligibility requirements. I do strongly encourage you to share it with your legal counsel. It's a pretty in-depth document that will help answer some questions. The retiree termination process, again, is highlighted here. You can click on the retiree termination of coverage form, and that's the form that you would need to complete when you are when we need to terminate a rehired retiree. The benefit booklet, a fact sheet, all of our other alerts or anything related to the high deductible health plan has been posted here. So we recorded the webinar that we did in September. We're recording the webinar again today, and it will get posted here as well, along with the PowerPoint presentation that was used today to serve as a reference for you. I do want to highlight here that there is an HBR support line for the portal. It's the 855-552-6272 number, or you can email hbrsupport@cobraguard.net. This is to gain access to the portal, to the enrollment and billing portal. Any questions about your access, assistance in loading eligible members, that information you can gain assistance through the support line or that particular email. In today's demonstration, we did provide in this PowerPoint some screenshots of how to load some of the reporting functionality that we went over in September. We also included the billing functionality screenshots so you all can use as a reference. We did get several questions at the last webinar about the website for HBRs to use. You know, you do need to register, you do need to get access through Cobra Card, so you will need to outreach to that number if you have not already got set up in the system, but this is the website that you use. At this time, I am going to unmute Carrie Cavanaugh with Cobra Card and turn things over to her so she can do the demonstration. And Carrie, if you will just say hello and go ahead and take the presentation over, we will get started.
All right. Good morning, everybody. Hopefully everybody can see my screen.
Yes, we can.
All right. This is the demo site for the HR users, which is what you'll be using to load employees to the system as well as pull a monthly billing statement. Once you log into the system, this is the main screen that you come into. Over here, there's a table of contents. You can search members, you can create a member manually, or you can also upload a census file that's provided to you in the email that I sent out once you've been registered on the system. The reporting functions, there are 4 reports that are available. There is a department census that can be pulled that will show everybody that has been loaded to the system for your employer group. You can also include dependents on this file, or you can exclude them. Dependent information is currently being added by the employees if they're adding their dependents to the coverage. There's also a dependent audit report so that you can verify any dependents that have been added and make sure that information is correct. There is an enrollment report that will show you any employee that has elected the high-deductible health plan. And I'm correcting myself from our earlier webinar. This report will also show anybody that has gone into the system and waived the coverage as well. The last report that is available is an outstanding transactions report, and this will show anything that is monthly bill that is outstanding for your particular department. Under the billing tab, there is an Excel format monthly statement. It will show you the most current statement that is available. And it will show you, anybody that is enrolled. It'll be for your particular employer group. It will also include an account number that is specific to your employer group, so that if a physical check is going to be mailed in, that account number can be included on that physical check. Also, it will show anybody that's enrolled. It'll show the month that it is billing for, and in this case, we're showing January as well as February, as well as the total amount that is due. Our PO box will also be included on the statement. So again, if you want to mail in a physical check, the address will be included on this statement. Any open transactions that are open for your employer group will show under this open transactions area. So if anything is, this is just showing December. If January was due as well, January would show on here under the open transactions. There's a tab to make a payment. If you want to mail in a payment, it'll provide you the mailing address here. Or you can also make a payment via ACH through Bank of America website. I do want to point out this billing PIN number, this will change every month. It will not be the same PIN number each month. You do need to make note of this PIN number, because once we hit proceed, it takes you to the Bank of America website, and you will be asked to put in that billing PIN number. So again, you do need to make note of that PIN number. Once we select proceed, we're going to be switched over to the Bank of America website. It asks for the invoice number that's being paid. And I also want to point out on the screen, if there's more than 1 month that is outstanding, the system does require you to pay the full amount that is due when you're paying through the ACH payment. So down here, you'll be asked for your checking or savings, the name on the account, the routing number, as well as the account number. And you do have the option to change the date that the payment is submitted. The default is going to be whatever day it is that you're logging into the system. But if you say we wanted to delay the payment until the 5th, on Friday you could change it to the 5th. Unfortunately, because we are in the demo site, when I hit continue, it won't show you anything. But typically once you've entered in all of this information and you hit continue, that's where you'll be asked to enter in the PIN number. So once you've entered in the PIN number and confirmed your payment, you will get a confirmation from the Bank of America website. It gives you some examples of where to find the information, the routing number and your account number. And that is it for the demo.
Okay, I'm going to take it back over, and I am going to, at this time, open it up for questions. So if you can type in your question, we will be more than glad to address as many questions as we have time for. The first question is this the link that we use as the employer to add a member? If so, how do we get set up? Yes, the link that appears on your screen now is the link in which you can load eligible members. And you can call or email the HBR Support Center at the number that's listed on the website to help you get set up. So let me just go back to our website, this 9 right here, 855-552-6272, where you can email Cobra Card and they can assist you in getting set up. Carrie, would you be willing to go over again the billing timeline in terms of what we did last time? We had a few questions about that last time, so just maybe for some clarification purposes.
Sure. The bills are run on the 10th of each month. We do month in advance. So on December 10th, January bills will be going out to the members, any member that's elected coverage, and also the employer bill will be available on the HR portal as of December 10th. Employees, there is a 31-day grace period, and again, I say we bill in advance. So the January billing that's getting ready to go out on the 10th, the due date of the payment is January 1st, but there is a 31-day grace period. So employer groups as well as members have until January 31st to make the payment. Employees that do not make the payment by the 31st will be terminated for non-payment, and the employer group will then see a credit on the next billing statement, which will be for February. They'll see a credit for that employee on that statement.
Okay, thank you. Hopefully that, we had several questions around that at our last webinar, so just wanted to make sure everyone understood that to clarify. If there are any questions, if you could go ahead and type those in and we will get those addressed for you. If not, we can end things here, and again, we will post this on the page in which you see now on our State Health Plan website under the HBR tab to use as a reference. Question we have now is, how will the credit be returned to the employing unit? And that will show up on the following month's statement, but Carrie, I'll let you go into a little bit more detail about that.
That is correct. So again, if the member does not pay for the month of January, the credit will then show on the February billing statement for the employer group. So you'll be billed, because we're billing a month in advance, you'll be billed for that person in January, and then you'll receive a credit for them in February if they haven't made their payment.
Okay. Thank you. Okay, well, we will go ahead and end things here. I do appreciate your time and attention this morning. Please feel free to use the reference guide and the materials that we have posted on our website for any assistance. If you would like to contact the HBR support line again, that number is 855-552-6272 with assistance to the portal. And again, thank you all for joining. I appreciate your time.